As you know, there are so many health disparities related to maternal and child health in Arkansas. And as my work grew in Arkansas, I really wanted to shift the narrative to innovative solutions in order to solve the maternal and child health disparities. And so we had the opportunity to write for a federal grant that is really a 15-year grant or 5-year grant that can be renewed for 3 times in a row that would focus on maternal and reproductive health. And the overall purpose is to find the best innovations for maternal and reproductive health with a focus on rural populations. And in this case, really focusing on Arkansas. I believe that the innovations that come out of the March Center will really help all of the rural U.S. Yes, we're really excited about some of our first research projects because they mirror some of the most challenging problems that Arkansas is facing right now. One of our projects is focused on maternal depression and really looking at policies in the state of Arkansas that have been implemented and how they can be rolled out even faster or rolled out in a way that reach more women, because we really want women to have adequate screening and treatment for depression prenatally and postnatally. And so I'm really excited about that project. A second is around gestational diabetes and using remote technology, in this case remote wearable technology, to really monitor gestational diabetes and provide access to treatment earlier for rural women or pregnant women across Arkansas. And then the third is around rural opioid abuse and how to support women, what types of supports they need in order to be successful in improving their own health and the health of their unborn child if they've had previous or current opioid misuse. 2 of the projects that we're working on through the Institute for Community Health Innovation that are related to maternal health. One is around nutrition or food as medicine in pregnant women. And so we know that a lot of women who have lower income struggle to get nutritious food, and that could include fruits and vegetables and high protein foods. And paradoxically, those women tend to have excessive gestational weight gain, and excessive gestational weight gain can lead to gestational diabetes and gestational hypertension, as well as higher rates of C-section. And so we have partnered with Walmart to provide Walmart benefits cards, and this is across the state, not just here in Northwest Arkansas, but across the state, to really provide low-income women with the opportunity to purchase the foods they like that are healthy foods. And so the cards are restricted to only healthy foods, but really allow them access to healthy foods. And then we are looking to see if we can reduce excessive gestational weight gain and ultimately improve moms and babies' outcomes. A second study is called Telemom, and it really capitalizes on this idea that wearable technology, as well as leveraging telemedicine in order to reach out to women early after they've given birth, to check on them and make sure that they are doing okay. And so we know that most maternal mortality happens in those first 2 weeks after giving birth, 2 to 3 weeks after giving birth. But most of the time, a woman doesn't see her doctor for maybe 5 or 6 weeks. And so if there is a problem, it can often go undetected until it becomes an emergency or urgent. And so we have done a research study. We're wrapping it up now to evaluate what if we did a nurse check-in call via telemedicine, and what if women wore a remote blood pressure monitoring device, or took their blood pressure using a remote device, and then wore a very simple thermometer that allowed us to remotely monitor their temperature for infection. Could we detect early warning signs, and could we get women into the treatment they need before something became urgent? And I think think the theme across all these research studies is translational research. We don't want to just document disparities. We know that Arkansas has challenges with maternal and reproductive health. We really want to focus on the innovative solutions that are going to reach Arkansas's women.